The CORE program is a unique opportunity for residents and young otolaryngologists to ask interesting questions regarding patient care, come up with research proposals, write them, and actually get funded.
The CORE process is where research is evaluated for its merits, and then that money is allocated appropriately to the best projects year after year.
The CORE grants from the Academy catalyze the funding for early stage investigators, including residents and early faculty in otolaryngology. And I think this is critical to be able to fund these clinician scientists, as seed funding is necessary to start their careers and gather interest in scientific research or clinical research in otolaryngology.
It's also an opportunity for young otolaryngologists to get recognized within the American Academy of Otolaryngology Head and Neck Surgery, as well as their respective societies. The biggest advice I would have for applicants is be thoughtful about the questions you ask and seek out mentors to help you with this research. It's also oftentimes helpful to see successful examples of grants that have been written, to see the format and how things are done.
Do not underestimate the effort it takes to write a CORE grant. Sometimes you look at the component and say, yes, I can do that. But when you start to engage in the process, it tends to develop a life of its own. So I encourage all of the applicants to start early, seek as much mentorship as possible, and don't underestimate the amount of work it takes to get the grant together.
The process for the CORE grants for applicants, particularly resident grants, I would recommend first identifying a research mentor that you can work with and a project that you are very interested in. The second thing is review the steps of the process online and all of the necessary documents. And third is the significance of the project. The project needs to be significant so that once the work is completed, it will have an impact either on our understanding of a disease process or our clinical care for patients.
The CORE application process is mirrored entirely after the National Institutes of Health grant funding mechanism. So in going through the grant proposal process, applicants basically are writing an NIH-funded grant and learn the process all the way from the beginning to the end.
All of the specific parts of the grant are the same: significance, innovation, research strategy, and also the environment and the investigator. And so those are really the similar process of the NIH.
When a CORE applicant puts in their research proposal, they learn just how difficult it is to get all the important components toward a research application or grant application. There are many components to it. It's not just about the science, it's about the person, it's about the support, it's about the environment, and the numerous other elements of the application. And sometimes it's hard to think about what those are until you sit down and have to put it down pen to paper. And so I think applicants really learn how much is looked at and how much is considered when CORE grants are reviewed. When a CORE recipient receives their grant, it is truly a feather in their cap in their career. The CORE grant process is designed to help researchers go from early phase to eventually additional extramural funding beyond the foundation stage. There's excellent data out there and published through the American Head and Neck Society that demonstrates that CORE recipients is a great way to identify individuals who will be very successful in future in their research. It can be career building, it can help institutions focus their resources, it can help in so many more ways than just the dollars that land on the individual.
Probably the number one thing that the CORE program does is it really lets other members of our societies know who these rising superstars are in research. It also helps people get funding in order to start work that can later lead on to larger grants and larger funding, especially from the NIH.
Yeah, I think the CORE grant recipients, it really catalyzes their career pathway early on in their career. Typically, these are second, third year residents in otolaryngology. And many of the future clinician scientists in otolaryngology have had core grants in the past. And this sets the stage for them to be able to be competitive in their research careers if they decide to use that in their career. For example, if they want to apply for seed funding or for a KO8 or a K23 as a junior faculty, that shows that they are already had funding and that they have research experience.
Besides getting grant funding to do the interesting research that you can do, it is an amazing opportunity to really push the boundaries in order to understand the diseases that we treat as otolaryngologists.
So the benefits of being an awardee is that obviously there's funding for the research, but typically, even though these are seed funded grants, often the project as a whole is not going to be completely funded by this, just the smaller amounts of the seed funding. So it's not just the funding for the project, but it gives the resident the ability to use that to shape their career in the future, and it allows them to interact with other awardees. And it also often allows them to become reviewers in the core so that they can also understand the other side of the review process.
When an individual receives a core grant, they really join a select few of individuals who have received such grants. It is well known within otolaryngology spaces what the core grant process is and how valuable and important those grants are. And it really shows to everyone that their research has been vetted by a robust peer review process, and this is an individual that is likely to be successful in the research space. The core grants process involves individuals of all levels of training, but a significant number of grants are awarded to residents. And for those residents, a resident research grant can be a huge way for that resident to step into a successful fellowship or a successful academic career subsequently. So for many residents, sometimes that's their first step in the research, and if it's a successful one, it is something that they carry for the rest of their lives.